In July, I was working a normal shift, which for me is usually 7 a.m. to 7 p.m. And driving into work, I felt like something was off. I did top-notch job of writing off all of my symptoms and not paying attention to them, even though I know what to be looking for, and especially even in a woman to know what cardiac symptoms could be. I was really struggling to get just to push the bed, which is something obviously that I do all day. And it wasn't necessarily that anything felt worse, it was just this kind of overwhelming fatigue and just this kind of something's wrong. One of the nurses that I was working with that day in particular said, "You don't look good, what's going on?" So I kind of reviewed my symptoms and I said, "I think I'm tired, I just need to go home." She said, "Okay, but just answer one question." And I said, "Okay." And she said, what family history do you have? Is there anything cardiac?" And I said, "My dad died suddenly at 44. He had a massive cardiac event and dropped." And she took my arm and said, "We're going." What I remember, because you're kind of loopy, was them saying, "Oh no, we're gonna have to open" during the catheterization. And I remember saying, like, "What, open? Who, what? Who are we opening? What are we doing?" So I had pretty high level blockages, and so they were unable to place a stent. Monday morning, Dr. Moulton was my cardiothoracic surgeon, and so I went in and he retrieved an artery from my arm and then one of the main arteries from my chest and did a bypass. When I would come in for a post-op visit or to see the doctor for anything, I would always kind of stop here and say hi to everybody and see what was going on. It was always just that same amazing feeling. You know, people would hug me and "When are you coming back?" and "I can't wait for you to come back." At 12 weeks, I got clearance from Dr. Moulton, and I came in for my first shift, nervous but ready, and had this just this amazing day at work, and where everybody I saw was, you know, "We're so glad you're here, and I'm so grateful that you're back." And I just left that shift kind of on cloud nine, like I did it, and you know, this is where I'm supposed to be. It's a huge message of how important it is not to ignore and to trust your instinct and trust your gut. It's kind of funny, listen to your heart. I have children and a husband and family and friends, and I don't think I'd be here. I think that it was enough and severe enough that, you know, I don't know if it would have been that night or you know, the next day or a month later, but I think that I probably would have repeated history. But I feel good, and I do realize how lucky I am. And some people have said, you know, "Oh, I don't know if I'd want to be a patient where I work." And my answer is always, I wouldn't want to be anywhere else. This is the place to be, you know, so I'm very lucky.